Here is my audience. I got 6 members. Do you know a friend or a family member who has struggled with infertility? Today, I will be talking about infertility. We're going to talk about what infertility is, what are the causes and risk factors, and what treatment options there are for infertility. First, let's discuss what infertility is. Infertility is defined according to the Reproductive Health CDC website, defined as not being able to conceive after 1 year of trying. There are 2 types of infertility according to the World Health Organization. Primary and secondary infertility. Primary infertility is where you've not been able to conceive at all, and secondary infertility is where you've able to at least have conceived once. The World Health Organization website also states that 48 million couples and 186 individuals worldwide are affected by infertility. According to the Mayo Clinic website, sometimes there's no specific cause for infertility. So now that we've talked about what infertility is, let's discuss causes and risk factors of infertility. Causes of female infertility is where we're going to start, and according to the Reproductive Health website on the CDC website, female infertility declines heavily after the age of 30. The MayoClinic.org website states that common causes of female infertility include ovulation disorders. A common one that you hear of is polycystic ovarian disease. Some other examples of female infertility causes are uterine or cervical abnormalities, fallopian tube blockage or damage, endometriosis, early menopause, or pelvic scar tissue, and any cancer or cancer treatments such as radiation or chemotherapy. Also, the World Health Organization says that disorders of the endocrine system can also affect female infertility. Now let's talk about male infertility. Causes of male infertility include abnormal sperm production or function due to health problems, sexual problems which include delivery of the sperm, and environmental factors such as smoking, alcohol use, steroids, depression, high blood pressure, cancer, and cancer treatments. Now let's discuss risk factors for both male and female infertility. As we discussed earlier, age is a big factor, so females after the age of 30, any tobacco use, alcohol use, being overweight or underweight, any exercise issues, and according to the CDC.org website, excessive emotional and physical stress can contribute to infertility because that causes absent periods. Also limiting the intake of prescription and non-prescription drugs, and for males avoiding hot tubs and hot baths, which can affect sperm production. So now that we've talked about the risk factors and causes for infertility for both male and females, let's talk about treatment options. IUI is a treatment option. It's an intrauterine insemination. In vitro fertilization, IVF, is also a common one that you probably hear. You also risk the chance of having multiple children or multiple babies when you do the IVF. IVF is a form of assisted reproductive technology, which is known as ART, and that is when the eggs and embryos are handled outside of the body. There's also oral medications that you can take for infertility. And then, so now that we've talked about all those, let's review what we've talked about today. We've talked about what infertility is, and that is common. The CDC website says about 1 in 5 women experience infertility in the United States. We've talked about the risk factors and causes that contribute to infertility, several age, tobacco, alcohol use. And then there's several treatment options available, such as the common ones, IUI or IVF. So by creating more awareness of infertility, we'll be able to discuss with that family or friend member that you may know, and how they could use treatment options and be able to help them when they're struggling with infertility. And here is my audience, all 6 members.